this is the mission of getting the health plans and the employers to cover this care. Today, we're only serving commercially insured patients, and we've negotiated these contracts. So we get paid essentially for only when a patient comes to Oshi, and then we get paid at milestones as they go through our care model, especially the multidisciplinary part, whereas Treta said they're meeting every 2 to 3 weeks with a dietitian and or GI psychologist to iterate through the treatment, right? First, figuring out what's triggering the symptoms. Is it dietary? Is it gut brain? Is it both? And then starting on, okay, let's implement the changes, dietary, or teach them the cognitive tools to improve symptoms and reduce symptoms. So we get paid through our own insurance contracts or employer contracts. So there's no charge to the local partners that we work with. That's really important to us. And in a way, we're actually helping free them up to really optimize their practice. As Treta said, let them, I had a GI physician who leads a practice say to me, we have so much colonoscopy, endoscopy demand. We need to be spending more of our time there to keep up. So if you guys can actually take some of this, functional gut brain patient follow-up care and, you have the right providers to actually help, that actually frees up our time and our practices resources to focus on this endoscopy, colonoscopy, higher acuity care. And so, that's really the what's in it for the local practice is that, lower admin time, lower follow-up with those complex high need patients so that they can really do, try to keep up with the volume on the colonoscopy side. And you had asked, I think, in our prep for this, just a little bit about numbers. So we were zero revenue when you and I had this conversation 2.5 years ago, and now we're in the 8 figures of revenue on an annual basis. And we saw almost as many new patients in the first quarter this year as we did all of last year, just so you get a sense of the growth, right? So we are on an exceptionally high growth rate. And, this year, Oshi as a practice will probably see between 15 and 20,000 new patients across the country. Just to put some numbers out there so people get a sense. We have over 50 clinicians on our team now, and we've been adding new clinicians to the team to try to keep up with all this volume.